So we are talking about a common valve condition or heart condition called as aortic stenosis, a major heart valve which critically narrows as a patient ages and commonly seen among elderlies. And this is very easily treatable. The only point is we have to have early diagnosis, and the patient has to recognize any symptoms or complaints like breathlessness, fatigue, palpitations, any giddiness on exertion or walking. And we had a similar patient, Ms. Shashikala, who came to me with these complaints, and we offered a very simple treatment called as an endovascular approach, or a minimally invasive approach, in which we replace the valve from a common artery or a big artery in the groin, go up, reach into the heart, and deploy that valve and come out. So this is called as a TAVI or a TAVR operation. A very simple operation. It does not need any open heart surgery or a open cardiac surgery or a thoracotomy, where when the surgical unit comes in and we put on a cardiopulmonary bypass machine and a major cardiac surgery occurs. And the advantage is the patients are immediately mobilized within 6 to 12 hours, minimal pain, and they are back to normal, complete resolution of their symptoms. And this is a way in which we are trying to also understand that this is a common disease. Everybody has to understand these symptoms, try to take medical approach or approach their physicians, diagnose this condition, and take the treatment as ASAP. Thank you.